No, it was just an error in terms of that staff member for which the Brisbane Airport Corporation has apologised. Errors happen, we know they happen, which is why we have all of those other mitigating factors in place, and they all worked. So it was picked up, they were moved back. Through CCTV footage, we've seen that people were wearing masks, people were maintaining social distance. The table that the two people sat at was thoroughly cleaned after they stood up and left, although no one at that stage knew that there was any issue. So people did what needs to be done to keep people safe every single day. And I would like to reinforce the importance. I know it is a mandatory requirement throughout Australia in domestic and international airports that people wear masks at all times, except when they're eating and drinking, and that's a really, really important thing for everyone to do.
So I'm confident that no one in that green zone have interacted close enough with these guys?
I am pretty confident. There's always a low risk. We think, we don't have genome sequencing yet on this man, and we may not get that because the amount of virus was so low, which is a good thing. But we know that in PNG at the moment they don't have variants of concern, such as the B117, but we do know that with variants of concern they can be very transmissible, which is why I can never ever be 100% confident that even when people have followed all processes that there isn't some remaining risk. But the remaining risk is very, very low. But I do ask anyone who's been in that international terminal at Brisbane Airport yesterday during that morning period to please, if you develop any symptoms at all, come forward and immediately get tested and isolate till you get a negative result.
Were there any customers in the cafe at the time?
Yes, there were. We looked at that, but we don't think any of them warrant needing to go into quarantine. We have asked the staff who were in the cafe at that time. They are being required to quarantine, but we haven't asked any customers. It's it's not an enclosed space, it's an open cafe within the international airport.
What's happened to the PNG travellers?
Right, so one of course is in hotel quarantine while we work out where they would need to go, because they were only intending to transit through Brisbane, and the second is in hospital.
And you said that they tested negative from PNG. Are you concerned that testing here may not be as adequate as the testing here? Were they allowed on the plane to follow that negative test?
Yes, but you've got to remember, we had an equivocal result yesterday. So even here, we had a questionable result yesterday. We didn't know whether it was positive or negative. Today, we've had a clear positive result. So that suggests to me, as well with the serology results, that he's right at the end of his illness. He could almost be fully recovered. And we know that the risk is always in that 48 hours before someone develops symptoms, at the start of their illness. He's right at the end, and he's well. So the risks are all adding up to be less and less and less.
So were they transferred to somewhere else?
Yes.
In Australia?
No, overseas.
And I guess basically the same chances of more restrictions being introduced off the back of this and more of the state.
Oh, very, very minimal. I don't expect there to be any consequences, but we always in Queensland take a very, very cautious approach, which we've done here.
Up Queensland. I'm a Queenslander.
Excellent.
Good on you.
Enjoying Melbourne?
Yes, lovely. You're doing a great job. And these guys are asking you questions. I love it. But you can give them a good answer.
They always ask brilliant questions.
Yeah, brilliant questions. I love it.
Thank
I
you.
love it. Being a Queenslander. Good on you, darling.
I was going to ask, how were they picked up? Like, how was it noticed that they were on the green zone?
I don't know. So that's been looked at by Brisbane Airport Corporation. So they're doing a review of this whole process. I must admit, Brisbane Airport Corporation, right from the start of this pandemic, have been brilliant. They have worked with us every single step of the way, and the response here was superb. And just going through all of the CCTV footage that went through and seeing how people were managing the whole process was excellent. So they'll now go through and work out what did go wrong so that this happened. That's up to New Zealand.
Do you know how many passengers there are?
Around 390 plus or minus a few.
Contacted? Is that again up
That's up to New Zealand, yes. But New Zealand was informed yesterday, and New Zealand has very, very good systems in place.
Is the bubble in your prison?
That's up to New Zealand. It's not from our end, but of course that's a choice for New Zealand to make.
Have any flights been cancelled because of this?
Not that I'm aware of, no.
What happens after they complete their hotel quarantine? They go to where they were intended to go?
Oh yes, of course. Once anyone finishes hotel quarantine, they just go back to their normal lives, whatever they're intending to do.
So they have to take them back to the international airport.
Well, they need to work out what they want to do. Yeah. And also people can leave quarantine early to fly overseas.
Just got a question about vaccination centres.
Yes.
There's a vaccination centre in Albert Waterways Community Centre on the coast. The ABC says that the public just rocked up and asked for the jab and they were given it, even though they're not in the 1A or 1B category. Do you know, can you explain why that's happening?
We're very careful to make sure that we use all the vaccine we possibly can, so I have no idea about the specifics there, but the message we give out in Queensland to all our vaccination centres is that our long-term aim is to get every single Queenslander who's able to be vaccinated. So they will make decisions. So we give a lot of support and a lot of ability to all of our areas in Queensland to make appropriate decisions based on at that point and in that point in time and depending what's happening. So I don't know the specifics there, but we'll always support people to get vaccinated. It is really, really important that anyone, particularly those who are vulnerable to getting COVID-19 and having terrible outcomes, that they get vaccinated as soon as they can. So anyone today who's 70 years of age or over, who is in one of the vulnerable cohorts, should be out getting themselves vaccinated. We just don't know what's around the next corner. We're all doing so well in Australia to limit the spread of COVID, but we know that it can happen at any time. So please, thank you for raising that issue. It's really important to get vaccinated.
And are you aware of any other positive cases in Queensland?
We get notified of all adverse events following immunisation. I'm not aware of any specific ones with that new clotting syndrome in Queensland, other than that initial one that we had that TGA confirmed was likely due to the vaccine. I'm not aware of any further ones, but we do get notified regularly of all sorts of outcomes.
There are further
Well, the TGA is our regulator in Australia, and they release a very, very good report every Wednesday evening. So it's really important to go online and have a look at that report, and that gives all the information. So we in Queensland will only have a certain amount of information, and then that needs to go to an expert panel, and they assess it and work out what the situation is. So the best way is to go to the TGA website and get that information.
Can I just clarify? I did say it was international airport worker the other before. It was obviously it's the passenger that is positive. It's the Brisbane Airport Corporation worker who allowed this to occur. But I know Brisbane Airport Corporation is investigating that, and we welcome that. We know that they've done an extraordinary job throughout this whole process. So.
Is that worker still working there?
Oh, look, I'm not aware if that worker has been stood down or not, but I have no doubt and I have full confidence that the Brisbane Airport Corporation will ensure that all of their staff are properly trained to avoid this occurring again.
Have either of you, just on the topic, sorry,
Sure.
either of you been briefed on the cyber attack in the United Kingdom? And if so,
So as the Chief Health Officer, I am responsible for licensing all the private facilities in Queensland. So as soon as it happened, they notified me. They have very good systems in place. It particularly impacted on their 4 hospitals in Queensland, so they put alternative arrangements in place. It is a real concern. We know that cyber attacks happen and there are systems to try and prevent that, but it's important that we have processes that we can put in place immediately should something like that happen, and that happens here.
has any confidential information, staff information been compromised?
Not compromised. but they're working through what it's meant in terms of what information might have been available. But they've got other systems so they can ensure, because from my point of view, of course, I know privacy is extraordinarily important, but I'm even more concerned that there was an impact on the information itself, and they have systems in place to make sure that that's managed.
Just the last division of hospital capacity. So did you reach any agreement on how to tackle hospital capacity?
So as we have been talking about for the last couple of weeks, is that I put on the agenda for the Health Ministers meeting today a discussion around particularly bed capacity and people who should be getting NDIS packages, but also aged care support either in the home or a nursing home, to work with the Commonwealth to address this. For Queensland, it's almost 600 beds and over $5 million a week. What I can say about the meeting we've had is that this issue is a national issue. All jurisdictions were identifying that they have very, very similar problems and pressures on their system, and we have agreed to work within a short time frame on some solutions with the Commonwealth in relation to that. So I'm very pleased that there is an acknowledgement there's a problem there, that it's not just limited to Queensland. In fact, the pressures on our health systems generally, every jurisdiction was identifying similar problems, and that we need to work with the Commonwealth to find some solutions going forward. No, we've set ourselves a time frame. We'll be coming back in the next 3 months at our next Health Ministers meeting to look at what work's been done and identified what solutions. What we do know is last year, in the middle of COVID, the National Disability Insurance Agency was able to transfer these people out of hospital beds very, very quickly. So we know it can be done. We've seen it work. What we want to do is see that commitment in the long term and not just in a peak of the pandemic.
In terms of short-term solutions?
Well, as I say, we've all agreed today that that work would be done, and we'll await the work that our officials will do with the Commonwealth and other jurisdictions as well, and come back together in a short time frame to hopefully see some long-term changes. And when I say long-term, short-term fixes, but that will be ongoing as far as reforms in this area.
Was there a rethink of federal funding discussed?
But as I say, these are confidential meetings, but we all had a very good discussion about the pressures on the system and looking at reform going forward to make sure our health systems across the country are sustainable, which includes GPs as well and bulk billing in our community. All good? Thank you.
Thank you very much.
Thank you.